Welcome to the week 4 edition of the Policy Corner at Home. And here's what went down and is coming up.
As you probably saw this week, the big thing that was a lot of coverage, the bill on youth residential treatment facilities, SB 127, got a committee hearing. Obviously, there was a lot of with Paris Hilton and other folks. It was a pretty covered event, but that bill was able to move forward. Our focus on this bill was to point out that while this is a good first step, there with some amendments that had been made in this committee to improve some of the concerns we had, that while this is a good first step, there are still a lot of gaps that are going to need to be filled in with future legislation, like ensuring kids have access to treatment and access to education services and a further reduction of the use of restraint and seclusion. Again, a good first step, but I think we're going to be watching, future legislative sessions. I think this bill will probably move forward. But we'll have to keep an eye on this moving forward in future sessions to continue to make improvements to the system.
Early last week, Senator Thatcher's SB 49, SB 47, and SB 53 both passed in the House committee. They would create consistency statewide in terms of training and application for crisis intervention training for police officers, and his second bill would create what he says is a first in the nation certification for mental health EMT. And we appreciate both of those efforts to fill gaps in our crisis response system. But as we've said consistently, we think additional efforts need to be made to make sure that folks have supports over the long term, so that they have a chance of avoiding crisis in the first place.
A couple of other bills that actually came out this week. We have SB 155 from Senator Thatcher, which is the first step in implementing the bill from the federal government, actually championed by Representative Stewart in Utah, to create a crisis line for folks to call akin to 911, but it would be 988. So the first step to kind of implement that so that there would be an effective number for folks to call in crisis, which would just go to helping build out that crisis response that we're looking to do this session. And another bill along those lines is HB 334 from Representative Elison, which requires annual training for crisis response to folks on the autism spectrum, as well as those as with other mental illnesses as defined in the bill. And so this is something we've been encouraging the city to look at in our discussions with the Racial Equity and Policing Commission. It seems largely in order after obviously what happened this past year with Lynn and Cameron. So we're really glad to see Representative Elison move this forward.
As we mentioned last week, the appropriations committee, the separate appropriations committees were finishing their work this week, and they finalized their priority list. A couple things that we noticed are that the DSPD providers and support coordinators are ranked pretty highly in terms of getting a rate increase, which is great for folks already in services. The unfortunate part is that there was only $1 million prioritized to bring critical need folks off of the off of the current waiting list, and the effort by Representative Ellison to get some help to families who've been waiting up to 20 years. So far, it looks like it's pretty far down the list. It could certainly use your help in reaching out to your senators and representatives and members of leadership and encouraging them to support families trying to care for their loved ones at home during the pandemic. Also, similarly, despite all of the progress that is being made legislatively around mental health issues, the funding priorities to implement a lot of these pieces that we passed last year and are discussing this year are also relatively far down the list. So they could also use your help in reaching out to policymakers and reminding them that this is the mental health of all of us is also a critical issue during a pandemic and beyond. And we expect that executive appropriations or leadership will begin meeting this week to talk through the different priorities of the committees and begin to make their own make up their list and start negotiations with the governor over what the final budget may look like. So this is the perfect time to reach out to them if any of these issues are of interest to you, or if you have ones that you are particularly following and are of importance to you or your family member.
So yeah, with the appropriations committees wrapping up, I think you're going to see a lot more committee meetings with bills. So we expect that bills should start moving much faster over the next couple of weeks. So we'll be watching those things closely. And with that, thanks for watching as always, and we will see you next week.
Adios.